forevermore. Amen.
Thank you, Mrs. Beal. Members, the House is now in session. Confirmation of minutes. The minutes of July 23rd have been circulated. Are there any amendments or corrections to those minutes?
Yes, Mr. Speaker.
Opposition Leader?
Mr. Speaker, as you know, there were irregularities on the motion to adjourn. And these irregularities result from various miscommunications and other issues. The debate took place. It was perceived to be inequitable. And so we in the opposition are asking if we can strike a reference to the motion to adjourn in regards to the National Sports Center from the minutes, or we defer the minutes when you and I can discuss it further.
Well, I'm going to say that I think this is a conversation that needs to be had off here. So you and I need to arrange a time to have a conversation regarding it, so I can try and get a better understanding of what your view is on this. But I am going to speak to that particular sitting in a moment.
So in the interim, may I ask that you defer these minutes?
I don't have a problem deferring it until we have that discussion.
Thank you, Mr. Speaker.
Okay. Any other amendments? There are none. The minutes have been deferred until the next sitting. Messages from the governor? There are none. Announcements by the speaker. Members, I want to use this opportunity to address the last sitting that took place on the 23rd of July. But before I speak to the 23rd of July, I should speak to the 16th of July. On the 16th of July, the MP candidate on the motion to adjourn rose to speak to a matter in reference to the National Stadium, National Sports Center, I'm used the correct name. And I cautioned him in the fact that the documents that he was referring to, I did not have sight of those documents. And I asked him to make sure at the earliest convenience that I am provided with a copy of the documents to which he spoke. The member did so, and it was my intention, once I had the documents in my hand, to review the documents against the Hansard to balance off what was said against what was in the documentation. That took a period of time to go through the Hansard word by word to confer that against the actual information that was provided in the documentation, which didn't get done before the following sitting on the 23rd. On the 23rd, I was not present in Parliament that day, as you all know. The Deputy Speaker was in the chair for the day. There is a miscommunication because on the 16th, at the time that we were on motion to adjourn, the Deputy Speaker was not present in the House because he was attending a family funeral. So he missed the entire exchange of what took place that day. So when he was in the chair on the 23rd, he was unaware. And I have to take some responsibility for that because he was not appraised of what took place at that time. I brief him, whenever I'm not available, I brief him on the other matters of the day that are normally the standard matters. That particular item, because I hadn't had a chance to review it yet, he did not get briefed on. So when we were on motion to adjourn and members got up to speak to the matter, he was unaware of what took place the previous Friday. When it was brought to his attention by our staff, he then interceded to say, look, I need to hold this off because I know there's a matter that the speaker is dealing with. So that's when he attempted to have that particular topic not spoken to any further. Unfortunately, at that time, MP Canada was on his feet and he was acting just to, hold off until the speaker had a chance to take his position on it. The unfortunate part is that they saw it from different perspectives and conversation continued when the deputy speaker was trying to have MP Canada to cease at that time and just hold it off till I was back in the chair. Resultingly, as you all know, the MP candidate was asked to leave the chamber, leave the sitting for that day. I stress that it was just for that day. MP candidate is welcome to join us today. I have spoken with him and indicated that even though he may have disagreed with the position of the deputy was in the chair, and he needed to honor the person who's in the chair no matter who's in the chair. And based on that, he's welcome to come back today, provided he just gives an apology for not acknowledging that the person in the chair had control of the House, as I would expect any member to recognize that whoever's in the chair has control of the House. So for the record, MP candidate is welcome to join back in today. He understands that you have to break an apology for just not honoring the deputy speaker as the person in charge of the House that day, and his request for him to cease. And the other part is that the information that was spoken to on the 16th, I've had a chance to do a full review of that against the information that was, the comments that were spoken to. I've had a full opportunity to review it all. And there was nothing in there that I would ask the MP candidate to withdraw, because all his comments were based on questioning of information that he had in his hand and information that was in the air, so to speak, of what had gone on. At one point while he was on his feet, he had attempted to speak of individuals by name, and I stopped him from doing that because I didn't think that was appropriate. But his comments, as far as questioning, I didn't see a problem with having to withdraw any of that. So he's welcome to come back in if he apologizes. That's my comments, my announcements for today. We'll move on. Messengers from the Senate, there are none. Papers and other communications to the House. There are 4 papers today. The first is in the name of the Premier. Premier?
Good morning, Ms.
Good morning.
Good morning, Mr. Speaker. Mr. Speaker, I have the honor to attach and submit for the consideration of the Honorable House of Assembly the proclamation proposed to be made by Her Excellency the Governor in exercise of power conferred on the Governor by Section 4 of the Public Holidays Act 1947 and acting in accordance with the advice of the Cabinet, declaring Monday, the 18th day of October 2021 to be a public holiday.
Thank you, Premier. The next is also in your name, Premier.
Thank you, Mr. Speaker. Mr. Speaker, I have the honor to attach and submit for the information of the Honorable House of Assembly the Bermuda Tourism Authority 2020 Year Review Report and the Bermuda Tourism Authority Consolidated Financial Statements for the year ended December 31st, 2020.
Thank you. The third one is yours as well, Premier.
Mr. Speaker, I think I just did both.
Oh, okay. Thank you. Come together. All right. And the final this morning as a paper and communication is the public health extension from Minister Wilson. Ms. Wilson.
Good morning, Mr. Speaker. Mr. Speaker, I have the honor to attach and submit for the consideration of the Honorable House of Assembly the Public Health COVID-19 Emergency Extension Number 5, Order 2021, proposed to be made by the Minister of Health in exercise of the powers conferred by Section 107A of the Public Health Act 1949.
Thank you, Minister. That brings us to a close to the papers and communications. The next item is petitions. There are none. Now move on to statements by ministers and junior ministers. And we have 8 statements this morning. The first is in the name of the Premier. Premier, would you like to present your statement at this time?
Yes, Mr. Speaker. Mr. Speaker, I just wanted to confirm that your honorable officers did receive a minor amendment that I had to make this morning based on a late development.
Yeah.
All right. Yeah. Thank you very much.
Moving up.
Thank you. Mr. Speaker, when this honorable House rose on the 23rd of July, the country eagerly anticipated Cup Match, witnessing the annual classic and enjoying this summer highlight with family and friends. We did that, Mr. Speaker, and we did so safely. The strict enforcement of practices adopted to keep us safe showed that we could adjust our lives to live with COVID-19 and enjoy different versions of traditional events and celebrations. Mr. Speaker, since the Cup Match holiday, we have seen an increasingly casual and in some cases almost cavalier approach to those very same practices that have kept us safe since the declaration of the global pandemic in March 2020. Mr. Speaker,
because I feel you're 10:30, but I'll call them and tell them.
Mr. Speaker, someone's not on mute. I'm sorry.
Yeah, I'm trying to figure his mic. I see it. I got it.
Thank you. Mr. Speaker, just a little over 3 weeks ago, as case numbers began to rise, the government announced new requirements for the use of SafeKey for indoor activities where masks are removed. Since that time, in a matter of weeks, active cases have quadrupled. Active cases have quadrupled to over 500, and there are now more than 20 residents in hospital with 5 persons in the ICU. My colleague, the Honorable Minister of Health, set out in comments earlier this week how this outbreak has been fueled by people ignoring basics and going to work when unwell. The same must be said of family and a business who failed to follow the traveler continuum on the return to Bermuda and cause a cluster in a school or camp setting. There are many other examples of persons not following the rules that have been made to prevent the spread of this deadly virus. The culmination of this is what we have now, a wave most harshly affecting the unvaccinated, those who cannot be vaccinated due to age or medical condition, and those who to date have chosen not to be vaccinated. Mr. Speaker, we now have community transmission. There are a significant number of cases under investigation, and the increased community testing continues to identify positive cases. In 2020, we would have been considering additional public health restrictions, a curfew, or even another period of shelter in place. But, Mr. Speaker, it is not 2020. 66% of our population is fully vaccinated, and the data around this outbreak confirms that its scale and scope is being driven primarily by transmission of unvaccinated persons to other unvaccinated persons. With our vaccination strategy validated by the protection against serious disease provided to vaccinated persons, we are not where we are in 2020 and not where we might have been with lower vaccination rates. Therefore, 2020's blanket measures that affect all persons and all businesses, despite their compliance with the rules, will not be immediately applied to this period in 2021. As long as we are able to properly manage the care of those who need medical attention generally and those persons with COVID-19, we have no need to revert to lockdowns and curfews. But, Mr. Speaker, these measures remain a possibility if we cannot take care of the sick in the community. We must continue to adjust our lives to live with the coronavirus and not so interrupt our lives that we again cannot worship communally, dine out as a family, or go to work to earn a living. The people of Bermuda, who by and large are following the rules, should not be subject to further interruption of their lives and livelihoods caused by persons who do not follow the precautions in place that will keep us all safe. Mr. Speaker, since March of 2020, this government has provided thousands of tests free of charge. Not one person in this country is paid for a vaccination. The government has not mandated testing, save for participation in sport or compliance with exemptions granted for large groups. The government has not mandated vaccination for any resident, in spite of other similar jurisdictions doing so for work permit holders, frontline workers, and public sector officers. This has been a study in the emphasis of personal choice, enhanced by public information, and a constant encouragement to consult one's own doctor. Mr. Speaker, the various regulations implemented since March 2020 have been measured and indicative of an overarching aim of keeping this community, and in particular its most vulnerable citizens, safe. None of this has changed, Mr. Speaker, and none of this will change. Mr. Speaker, this next phase of moving beyond the pandemic cannot have blanket government intervention in the management of all areas of the economy, cultural life, or casual interactions as its cornerstone. The next phase must have at its core a theme of personal responsibility. We must now take charge of our own interactions and act sensibly and safely. This means that if an event is for 20 people, then 20 it must be. This means that if we are in a setting where mask wearing is mandated or strongly recommended, then you should wear a mask. This means that we cannot act like COVID-19 is a thing of the past and party like it is 2019. Mr. Speaker, the stage is set, the information is widely available, and we as a community know what we should and should not do in order to keep ourselves, our families, and each other safe. Mr. Speaker, save for changes to group sizes, the details of which will be confirmed by the Honorable Minister of Health later today, there are no major proposed changes to existing public health regulations at this time, because that which is in place, if properly followed, is enough to keep us safe. Therefore, there will be a redoubled effort to fully enforce the rules that are in place. Various elements of the public health enforcement teams will meet later today, and coming out of that discussion, I expect to see broader enforcement of the existing regulations this weekend and beyond. Large groups granting exemptions should be expected to be visited and subjected to confirmation of the correct use of SafeKey and other conditions under which the exemption has been granted. Licensed premises and indoor bars and restaurants can expect the same. The enforcement will be broad, and my expectation is that it will also be fair. This is the only way that we will ease the growing pressure on the various elements of our healthcare system, which are stretched and strained. Mr. Speaker, the current regulations provide the Minister of Health with the authority to close offending establishments. A recommendation is likely to be made to extend that power to a senior police officer in keeping with previous practices under the former regulations. This power will be used sparingly, but the immediacy it affords will provide maximum protection in the event of an apparent breach. Mr. Speaker, it should be clear that the government desires a zero-tolerance approach from enforcement agencies. If a place that is required to have SafeKey has patrons present with no valid SafeKey, it should be closed for a period according to law. If a place is not collecting contact tracing details as required, it too should be closed according to law. If an establishment that requires staff to be masked and they are not masked, it too should be closed in accordance with the law. The government has implemented a fixed penalty regime, and this too must be employed in the enforcement regime. Mr. Speaker, before I close, I want to speak to the healthcare workers and the first responders of Bermuda. Mr. Speaker, our healthcare workers deserve better than what our residents are giving them. These dedicated men and women have been working flat out for 17 months, collecting test samples, running tests, collating statistics, sharing information, contact tracing, producing guidance, all while still taking care of responsibilities outside of work. These are fellow citizens who have gone above and beyond, often putting themselves in harm's way. It is not fair to them to expect them to keep up the same pace and diligence when our residents are not following the rules and doing what is necessary to break the transmission of the coronavirus. The abuse that has been held in person, from persons waiting to be tested, online to those conducting the tests, and by phone for those trying their best to deliver results is not acceptable. In Bermuda, we have become accustomed to results the same day, testing availability the same hour, and people going the extra mile to accommodate last-minute behavior. Mr. Speaker, this government will not heap more stress on our healthcare workers and ask them to do more when they barely have the energy to keep up with their current workload. I must ask all persons in this country to be patient while our healthcare workers deal with this surge. Things will take longer than they normally do because those on the front line are human. Mr. Speaker, I would sincerely hope that all honorable members will echo that sentiment because our healthcare workers in public health and in the hospital have gone above and beyond. Mr. Speaker, for these last several months, I have placed an emphasis on unity. Unity of purpose has led to the sight of home porting cruise ships berthed at our ports. Unity of purpose is seen as welcome increased flights and leisure visitors. Unity of purpose is put people back to work and allow them again to earn in support of themselves and their families. That same unity must now be converted into personal responsibility to preserve and grow what we have achieved. People are still getting sick. Some are unfortunately in the hospital, and still others have sadly passed away. Now is not the time for us to act with wanton disregard and be resigned to a lockdown to solve a problem caused by that wanton disregard. As a country, we have been doing this for 17 months, and it's now time for each of us to adjust our behavior, follow the rules, and take personal responsibility to do our part to reverse the current trend and end this outbreak. Thank you, Mr. Speaker.
Thank you, Mr. Premier. The second statement this morning is in the name of the Deputy Premier. Deputy Premier, would you like to present your statement at this time?
Yes, Mr. Speaker.
Go right ahead.
Good morning to you and good morning to the listening public and colleagues in the House of Assembly. Mr. Speaker, today I'm tabling the bill entitled the Invasive Alien Species Act 2021. Legislation that will greatly enhance the island's biosecurity against the introduction, and spread of pest species. Mr. Speaker, invasive alien species are, and I quote, plants, animals, pathogens, and other organisms that are non-native to an ecosystem and which may cause economic and environmental harm or adversely affect human health. In particular, they negatively impact local ecosystems and ecosystem functions through competition, predation, or transmission of pathogens. Mr. Speaker, I am pleased to announce that the tabling of this bill is one watershed moment in government's efforts to mitigate effects of climate change. More will be coming on this subject of climate change. Many believe that the impact of climate change will mainly be seen in rising tides and stronger hurricanes. The threat to our ecosystem is another risk that cannot be ignored. Honorable members will be aware that this year the United Kingdom serves as the president of COP26. They have published 5 campaigns for avoiding dangerous climate change. One of these is entitled Nature. Mr. Speaker, with your indulgence, I will quote from the UK's description of their nature campaign.
Continue.
Thank you. Humanity faces the twin threats of climate change and biodiversity loss, which together are undermining nature's capacity to sustain healthy life, nutritious diets, and national economies. The two are inextricably linked and need to be tackled together urgently with equal ambition. They go on to write, Mr. Speaker, we will use our COP26 presidency to build on the foundations laid at the 2019 UN Climate Action Summit, working with governments, businesses, and civic organizations to raise ambitions on tackling the drivers of climate change and biodiversity loss, mobilize financing to protect and restore critical ecosystems, and kickstart a just rural transition towards sustainable land use to benefit people, climate, and nature. Mr. Speaker, the department in the Ministry of Home Affairs, particularly the Department of Environment and Natural Resources, are very focused on the protection of our delicate ecosystem. This bill offers DNR, the department, greater powers to protect against further incursions of species that could threaten and indeed destroy our ecosystem. Unfortunately, modern global travel and supply chain, which, while essential to Bermuda's economic survival, also makes the island increasingly vulnerable to the introduction and proliferation of invasive species. New species have been and still are deliberately introduced to Bermuda with the best intentions, including as pets, as food, or horticultural interests. They can also arrive unintentionally as hitchhikers on planes and boats. Regardless of how they arrive, some species have and undoubtedly will in the future adapt aggressively, spreading quickly in their new environment to our detriment, and so become invasive. Mr. Speaker, I would like to illustrate the destructive impacts of invasive species with two telling examples. The first is on the island of Guam in the West Pacific. Unfortunately, they have a problem with the brown tree snake. Like our island home, Guam has no natural predators against snakes. In the 1950s, the brown tree snake arrived, likely as a hitchhiker in cargo planes from the adjacent Solomon Islands. Since that time, it proliferated, spreading throughout the island, causing significant damage to the island's economy and ecology. As the name suggests, it is a gifted climber as well as a voracious predator. In 2016, the United States Department of Agriculture reported that, and I quote, "On Guam, the direct damages from brown tree snakes are clear. Only 2 of 12 native forest bird species on the island remain. $4 million is lost annually in productivity from snakes electrocuting themselves on power lines. 1 out of every 1,000 emergency room visits results from a snake bite. And it costs $7 million per year to manage. The second is closer to home. Excuse me, Mr. Speaker. Our sister overseas territory, the Cayman Islands, has a major problem with the invasive green iguana. The green iguana can grow up to 5 feet long and 20 pounds in weight, with an average lifespan of 10 years. It can lay up to 20 to 70 eggs per year. It is an excellent climber, swimmer, and burrower. Apparently, it arrived in Cayman in the early 1990s as a pet. With no predators, it quickly became a pest to crops, as well as fruiting and flowering trees. It damaged walls and walkways when digging burrows and caused power outages. Lastly, it was found to be a transmitter of salmonella, contaminating surfaces and water via their feces. To combat this problem, the Caymanian government initiated a program in 2018 to eradicate the green iguana. As of January 2021, over 1,260,000 iguanas had been culled at a cost of nearly $7 million. The lesson learned from these examples, Mr. Speaker, is that earlier a problem can be detected, the more rapid and effective response can be made to hopefully reduce damage and mitigation costs of a problem. And we have our problems here too, Mr. Speaker, I must say. That said, the best defense is not letting the problem get a foothold in the first place. Mr. Speaker, unfortunately, we have our own examples of species that have led to the destruction of our lands and certain endemic species. Casuarinas, which were brought in to replace cedar trees decimated in the 1940s, blight, are together with the Brazilian pepper tree, contributing to the destruction of cliff faces and which are threatening homes and causing further coastal erosion. The Brazil pepper tree also contribute to the destruction of many of our mangroves. If you are not aware, mangroves serve as a nursery for several species of fish. Pacu fish, a relative of the piranha, was brought in for aquariums, but are then dumped into our wetlands, such as Pittman's Pond in Somerset, which you should know very well, Mr. Speaker, Long Bay, and are now threatening our native plant and animal population. Some efforts are already underway to manage these species, but this good work can easily be undone as there is currently little legislation in place to control the breeding, selling, and release of pests into the environment. Plants such as casuarina, Indian laurel, pothos vine, and umbrella tree are sold commercially. Animals such as red-eared slipper terrapin and the lionfish are still popular in the pet trade. Mr. Speaker, this new legislation means to address this deficiency by providing a stronger regulatory framework to A, prevent the introduction of new invasive species, and B, create controls to prevent the spread of any such species that have or do become established. Mr. Speaker, recognizing the significance of this bill, the government has just completed a month-long consultation seeking feedback from the public using the online citizens forum, as well as direct requests to stakeholders such as pet stores, plant nurseries, landscape designers, veterinarians, government boards, and environmental groups. The government sought views on how to improve the proposed legislation, the licensing and permitting issue, offenses, penalties, and the species listed in the schedules. Mr. Speaker, all submissions were considered, and consequently several modifications were made to the bill, specifically to the powers, offenses, and schedules. The result is an effective regime tailored to Bermuda's requirements. Mr. Speaker, I want to emphasize that we are not intending to make criminals of persons who may have species that they are not even aware are growing in their garden. The bill has been amended to clarify that language to focus on the import, breeding, sale, and intentional propagation of prohibited and restricted species. At this juncture, I would like to take the opportunity, Mr. Speaker, to extend my sincere gratitude to all those contributors who took the time to make submissions. Their feedback was invaluable. Mr. Speaker, with that, I believe this serves as a good introduction to the bill, and I look forward to the coming debate on the 24th. Thank you very much, Mr. Speaker.
Thank you, Deputy Premier. The next statement this morning is in the name of the Minister of Finance. Minister Dickerson, would you like to present your statement at this time?
Pleased as you, Mr. Speaker.
Go right ahead.
Speaker, the purpose of this statement is to provide an update on the progress being made to enhance the conduct framework for the financial services sector in Bermuda. The enhanced framework is intended to further develop existing conduct requirements to create fairer outcomes for customers as they engage with the banking sector. Mr. Speaker, the government takes the view that the regulatory framework for financial institutions should be enhanced to provide additional requirements regarding the conduct of financial institutions and the protections of customers. The government also takes the view that the authority, in particular, should adopt clear and consistent regulatory processes to achieve this objective. Mr. Speaker, against this backdrop, and in order to further enhance the financial services sector framework, the House is advised that the authority does not have a specific power to enforce protection of customers using financial services offered by financial institutions. Although certain acts make explicit note of the authority's role in protecting clients and potential clients of registrants, the relevant provisions of the Banks and Deposit Companies Act, as well as other relevant acts, are primarily concerned with preventing breaches of law rather than focusing on fair outcomes for customers specifically. Mr. Speaker, it is proposed to amend the Banks and Deposit Companies Act of 1999 to provide a power for the Bermuda Monetary Authority to issue codes of conduct in relation to the manner in which an institution conducts deposit-taking business. It is also proposed that appropriate changes will subsequently be made to the customer-facing component of the regime, which will fall under the auspices of the Department of Consumer Affairs. Thus, matters relating to customer complaints will be overseen by the Department of Consumer Affairs. Discussions between the authority and the department have commenced and will continue to be progressed to ensure that the overall regime achieves the objectives of providing appropriate protections to the customer. As part of this work, there will also be amendments made to the regulatory and other legislation to allow for appropriate sharing of information. Mr. Speaker, as previously noted, the authority does not seek to resolve individual complaints, but will ensure that the financial institutions have the appropriate policies, processes, and internal structures to treat their customers fairly, as well as a robust complaint handling mechanism. The authority will coordinate its efforts with the Department of Consumer Affairs to monitor breaches of conduct across each sector and to deal with non-compliant companies. They will also monitor how institutions are adhering to the market code of conduct or practice. Mr. Speaker, in view of this, the House is advised that the authority has conducted a review of conduct standards set down by the following international standard-setting bodies: the Bank for International Settlements, the International Association of Insurance Supervisors, the International Organization of Securities Commissions, the G20 High-Level Principles on Financial Consumer Protections 2011, and the Organization for Economic Cooperation and Development. Mr. Speaker, the standards establish the actions that could be taken by supervisors to develop an effective conduct framework. Regarding general measures to safeguard the interest of both the consumer and an institution, Principle 1 of the G20 High-Level Principles on Financial Consumer Protection to 2011 provides that financial consumer protection should be an integral part of the legal, regulatory, and statutory framework. Principle 1 also provides that such protection should also reflect the diversity of national circumstances and global market and regulatory developments within the financial sector. Mr. Speaker, in this regard, the House is advised that the authority commenced a consultation process in August of 2020, concluding in April of 2021. The objective of this consultation was to gather views of the public on the authority's long-term conduct agenda. Reference is made to the following consultation packages: the Bermuda Monetary Authority discussion paper entitled "A Conduct of Business Regulatory Framework for Bermuda," dated August 2020, and the Bermuda Monetary Authority consultation paper entitled "Proposal for a Conduct of Business Regulatory Regime," dated December 2020. Mr. Speaker, the authority's proposed approach to the supervision of conduct of business has been encapsulated by 6 high-level principles, which are as follows. The firm must ensure fair and equitable treatment of its customers. The firm must have continuing regard for the interest of its customers in the conduct of its business. The firm must ensure that communications with customers are fair, clear, and not misleading. The firm must ensure that protection of customers' assets against loss, fraud, and misuse. The firm must handle complaints and errors in a manner that is fair and expedient. And we're dealing with retail customers. The firm must ensure that individuals are aware of the responsibilities within the business relationship and have access to appropriate financial educational resources. Mr. Speaker, the package was targeting a wide range of stakeholders, both the general public and relevant organizations and institutions. A stakeholder response letter was also published by the authority on the authority's website in April of this year to address the queries raised during the consultation process. Mr. Speaker, among the multi-layered results that can be extracted from stakeholder replies, the most prominent areas of action include those related to scope, timing, and retail versus non-retail customers. Below is a summary encompassing the main findings of the consultation. As it relates to the application of the proposal, the authority advised that the details will be incorporated into sector-specific codes of conduct. The authority also advised that the codes will reflect the diversity of Bermuda's financial services market. With respect to timing and implementation, the authority advised that it is intended that codes of conduct for the banking sector will be put in place before year-end. Codes of conduct for the insurance sector will be amended to include the relevant provisions before year-end. A transition period yet to be determined will also be put in place to provide institutions with time to adjust to new requirements. As it relates to regulatory treatment of retail and non-retail customers, the authority advised that the codes are intended to be proportionate to the nature of the customer and that individual implementation will be primarily focused on retail customers. And as it relates to cross-border scope, the authority has advised that the codes are intended to be applied in the same manner as all other provisions of the relevant framework. The authority also accepts that an entity may comply with what they deem to be a higher standard required by a foreign jurisdiction. Speaker, in that context, the key amendments to the Banks and Deposit Companies Act of 1999 are as follows. The authority's statutory powers will be expanded to include protections for customers and the promotion of the fair treatment of financial services customers. The authority's powers to obtain information will be expanded to include a power to obtain information and reports from a licensed institution regarding codes of conduct. It is also proposed to amend the relevant provisions of the BDCA to include a power to obtain information and reports regarding the safeguarding of the interests of clients and potential clients of an institution. Minimum criteria for licensing is set down in the second schedule of the Act. The minimum criteria will be amended by including obligations to comply with codes of conduct. And the authority and the Ministry of Home Affairs will also agree additional changes to the framework to provide for information sharing between the authority and the Department of Consumer Affairs. Mr. Speaker, the House has also advised that the authority carried out a review of relevant frameworks in other places and noted that while some jurisdictions have separate supervisory authorities for prudential and conduct supervision, there are some where the same regulators also have responsibility for both prudential and conduct supervision. Given the scale of the Bermuda financial services market, it is feasible for the authority to assume the conduct of business mandate alongside its prudential responsibilities. Mr. Speaker, the authority will initially incorporate conduct supervision within its supervisory units, as these units already have a strong working relationship with the financial services institutions and understand the business model of each sector. As the conduct supervisory framework matures, the authority aims to establish a dedicated unit devoted to conduct supervision. Mr. Speaker, the authority will soon issue the relevant draft code of conduct for consultation, as it is proposed to finalize the codes by year-end 2021. In addition, the authority has already met with financial institutions to discuss these matters. It is also proposed to put in place a suitable transition period to allow banks to come into full compliance. It is also agreed that the authority will proceed with the Code of Conduct proposal in the first instance. Amendment to the consumer affairs regime will be assessed based on the outcomes of technical discussions already underway, together with feedback received during the next phase of the consultation process. Mr. Speaker, in closing, I would highlight the importance of these proposed changes to the regulatory framework to ensure that there is even greater focus within this jurisdiction on matters relating to consumer protection in the financial services sector. This is consistent with this government's commitment to a fairer and better Bermuda. In this regard, I wish to express my sincere thanks to the Ministry of Finance, the Authority, the Ministry of Home Affairs, together with the Ministry of Legal Affairs, for their assistance with the development of the framework. Thank you, Mr. Speaker.
Thank you, Minister. The next statement this morning is in the name of the Minister of Education. Minister, would you like to present your statement at this time?
If it pleases you, Mr. Speaker, I'm just waiting for my video to come on. I think it's up now.
Go right ahead, Minister.
Okay, Mr. Speaker, I rise today to share with my honorable colleagues and the community at large an update on the impact of COVID-19 in our public and private schools. Mr. Speaker, yesterday was the first day back to school for the Bermuda public school system after the summer break. While we did everything within our power to return to in-school learning, circumstances out of our control pushed us to make the tough decision to start the school year with remote learning. This is less than ideal, and the announcement made this week Tuesday for a Thursday opening only added additional stress to our parents and guardians, and I wholeheartedly apologize for that. It is not lost on us the strain this creates to the broader public when parents and guardians have to change their day-to-day plans with little notice. Mr. Speaker, the public school system is not alone in making these difficult decisions. Only yesterday, we saw Work Academy announce that their senior school will be transitioned to remote learning as of today. Salters Grammar School announced they will open the school year for their middle and senior school students via remote. Bermuda Institute as well has made the difficult decision to go remote after only just opening in August. Like the public school system, the parents and guardians of both private schools were only afforded 1 to 3 days notice. We certainly can appreciate and empathize with our parents and guardians while we endeavor to place the safety of all children and staff at the forefront. Mr. Speaker, although remote learning is not ideal, I can confidently say that we are prepared. The donated Chromebooks have been distributed to all of our primary schools, P3, P4, P5, and P6 classes, consisting of 1,349 students. The professional development that has taken place over the last year, and more specifically this summer, was explicitly done to take advantage used by Chromebooks. While we had we will pivot books. We are actively pursuing additional donors who will enable us to complete our desire to place a device in the hands of all primary and preschool students. Mr. Speaker, the best place for our children is in school because it allows their parents and guardians to get to work and reduce the stress of trying to work and moderate their online learning. Teachers also perform best when they have their students in classrooms. In-school instruction allows teachers to form personal connections that help develop individual relationships with their students, relationships that are critical and that will lead to better educational outcomes for the students. The data shows that this is the best environment for effective learning. Mr. Speaker, the American Academy of Pediatrics can be quoted in their recommendations for opening schools for fall 2021 as saying, and I quote, "We need to prioritize getting our children back into schools alongside their friends and their teachers, and we all play a role in making sure that happens." The pandemic has taken a heartbreaking toll on children, and it is not just their education that has suffered, but also their mental, emotional, and physical health. Combining layers of protection that include vaccinations, masking, and clean hands hygiene will make in-person learning safe and possible for everyone.
Now, Mr. Speaker, the government has done a tremendous job of putting in a testing regime that is the envy of the world. These efforts have afforded our people freedom of movement in relative safety that other countries do not enjoy. For our students, we have worked just as hard. We have worked hard to put a saliva screening program in place to screen our staff and students for possible infection regularly. We've hired more staff to clean and enhanced the cleaning protocols within our schools. Hand sanitizers, stickers on floors to show 6-foot distances, signage, and the like have been done. However, Mr. Speaker, this is all for naught if no one takes advantage or does what's required outside or inside of our schools. Mr. Speaker, as of today, just over 50% of our students have consent from their parents to be part of the saliva screening program, and even fewer percentage of staff have consented. Although we continue to have staff test positive for COVID-19 resulting from close contacts of other infected persons. It can be easily observed that people, including children, are not wearing masks when required to do so, and at times highlighting on social media and the like when they can avoid using SafeKey to enter events and places that require them. I have even heard stories of events and locations that require SafeKey, yet not adhering to those rules. I cannot stress enough that we as a people must exercise a level of personal responsibility, particularly if we desire to have our children return to in-school learning in short order. Mr. Speaker, our goal has always been and will continue to be one of using data on hand to make decisions and guidelines in the interest of safety and health for our students and staff. However, the policies within our school buildings will never be as effective as they can be if people outside our school buildings are not responsible. To have safe schools, we as a community and as an island need to do our part. Be responsible, follow the guidelines, and do not put yourselves in positions to be exposed to COVID-19. Remember, our individual irresponsible behaviors can profoundly affect others when exposed within a school, causing quarantines and closures. The education of our children is then put at risk. Mr. Speaker, we are still reviewing the data for all schools to get them back to in-school learning as soon as possible. We are hopeful that we are able to get some schools back to in-school learning as early as next week. However, several factors will have to be taken into account, such as country status, staff and substitutes, and testing result status to make these decisions. While we cannot mandate anyone be tested before returning to school or participate in the saliva screening program, we urge our staff, parents, and guardians to consider doing so. We hope you are not just thinking of yourself, but we advise you to consider the effect your actions may have on others and our ability to get our children back into school. Mr. Speaker, as I started this statement, our children need to be and deserve to be in school for in-school learning. We, as adults, must do our part to make this happen. I'm asking all of Bermuda to do what is required to ensure our students, both in the public and private schools, can go to school, sit in class, and learn. Thank you, Mr. Speaker.
Thank you, Minister. The next statement this morning is from Minister Ferber on behalf of the Minister of Works and Engineering. Minister Ferber, would you like to put your statement?
Thank you, Mr. Speaker. Good morning, Mr. Speaker, and good morning, colleagues. I rise today to provide this honorable House with the fifth update on the short-term stimulus program that was launched by the substantive Minister of Public Works, Lieutenant Colonel David Birch, on December 17th, 2020. With a maximum budget value of $13,385,000, where small to medium-sized contractors were invited to participate in the opportunity to provide or to complete infrastructure projects around the island. Mr. Speaker, you will recall the program was launched because it was determined there was an urgent need to provide stimulus to the local economy to retain and boost employment numbers in the wake of the economic downturn sparked by the COVID-19 pandemic. As a result, the Ministry of Public Works compiled a list of shovel-ready projects that are executable almost immediately. These projects are mostly infrastructure improvements and will not add further burden to government's operational expenses. The project selection principles are to maximize the employment of the private sector while providing much needed refreshing to some of the island's neglected infrastructure. Mr. Speaker, the guiding principle of this program is to prioritize all companies that provide the most benefit per dollar spent while spreading the work among Bermudian-owned and operated businesses. To ensure a fair and equitable allocation of stimulus funding across the participating businesses, the ministry maintains a register of approved contractors and awarded contracts to ensure that no one company monopolizes the project list. Once a company obtains a project, they will be rotated to the bottom of the list to allow other companies an opportunity for work. Mr. Speaker, I had the pleasure of attending Albert Beach last Friday, September 3rd, to announce the completion of the first phase of one of these stimulus projects. The Albert Beach public stair access was officially reopened last Friday after being washed away during Hurricane Teddy, which brushed by Bermuda on September 21st, 2020. First phase included replacing the old damaged wooden staircase with a robust boulder-supported foundation and concrete stairs, which should withstand future hurricanes and storms for years to come. Phase 2 will include a boulder revetment work immediately to the east and west of the new staircase to access the project to protect the shoreline from erosion. Mr. Speaker, the contract to complete this work was awarded to Mr. Smith Hauling and Excavating and was valued at $199,954.94. The work commenced on May 17th this year, and I'm happy to report that the project was completed on time and on budget by July the 20th. The project employed 7 individuals, with 3 out of the 7 previously unemployed. Mr. Speaker, as of today, there are 11 projects that are ongoing. 10 are completed, which is a total of 21 projects that are underway or completed. 11 projects currently ongoing are as follows. Artemis Building B interior work awarded to Integro Interiors Limited. New plant inspection building at Botanical Gardens awarded to Daniels Construction. Veranda repairs at Camden awarded to Limestone Holdings. Darrell's Wharf Dockyard repairs awarded to the IASA Limited. Agricultural Service Center Engineering and Design, a service award to Brunel Limited. Ori Carpentry Shop Electrical Design Services award to George Headley Limited. Judicial Department Interior Design and FFE Service award to Cooper and Gardner. Artemis Building Washdown Area award to Heart and Soul Construction. Wastewater Section Landscaping Project A2C awarded to Unity Edible Landscapes. Roadside Vegetation Removal VC Street awarded to Island Construction Limited. And Roadside Vegetation Removal Ferry Road awarded to Blue Rock Construction and Roofing. Completed projects: Elbow Beach Public Access Stairs, as I mentioned earlier. Molecular Diagnostic Laboratory completed by Grayman. Mr. Speaker, Roadside Fencing Project 5, Molly Bay Road, St. George's completed by Global Innovation. Artemis Building A Loading Repairs completed by Next Level Development. Roadside Fencing completed by Creative Interiors Management. Roadside Fencing 3, Government Hill, completed by Brown and Company. Dock Maintenance Pack 2, completed by Triton Water. Dock Maintenance Pack 3, completed by Casio Limited. Roadside Fencing, completed by ATEC Contracting. Flex Bridge Hand Railing project, as you all see, was completed by Strike Force General Trucking, Excavation and Maintenance. Mr. Speaker, beyond these projects, there are also several projects in the RFQ and evaluation phase, including the cleaning of Pembroke Canal, removal of roadside vegetation, quarry slate shelter, and the wastewater section landscaping project D to E. Mr. Speaker, from a financial perspective, the stimulus program to date has spent $3,206,059.80, which represents 24% of the total stimulus funds. And 19 out of 93 companies have been awarded contracts thus far. Mr. Speaker, the bottom line and perhaps of the utmost importance to people of Bermuda are the numbers employed. While I await job figures from all of the contractors, I confirm that based on the numbers submitted thus far, this economic stimulus program has created at least 51 jobs, with 40 of them going to Bermudians. We are delighted with the progress made thus far from both contractors and their employees. Mr. Speaker, I think it's important. I immensely am proud, and I'm sure the Honorable Colonel Byrd, likewise, of the entire team at the ministry. They have all been working extremely hard on the initiative led by Mr. Robert Richardson, a young, talented Bermudian, for coordinating the work of all those involved. Speaker, I'm equally proud to say that the Economic Stimulus Program is an excellent example of the Ministry of Public Works' commitment to advancing capital projects that keep our people employed while strengthening the infrastructure of our island home. Thank you, Mr. Speaker.
Thank you, Minister. The next statement this morning is that in the name of the Minister of Health. Minister, would you like to present your statement at this time?
Yes, thank you. Good morning again, Mr. Speaker.
Morning.
Today, I will be tabling in this House a bill entitled the Health Insurance Amendment Act 2021, which introduces amendments to the standard premium rate and enhanced benefits under the health insurance plan and future care. The Health Insurance Act 1970 forms the cornerstone of our current national health insurance system, and together with the regulations made under the Act, it prescribes the minimal mandated package of health insurance for all. Specifically, the standard health benefit and the mutual reinsurance fund make up the essential components of an insurance package that all employers must provide and all insurers must include in any policy. Mr. Speaker, the SHB premium portion covers select diagnostic imaging out of the hospital, such as mammograms, select medical home care benefits, such as IV infusions, and select services that support home care. The mutual reinsurance fund is a prescribed amount which each insurer pays into the pooled fund. It covers most local hospital-based care, both inpatient and outpatient services, all insured persons' kidney care, which includes transplants, anti-rejection drugs, transplant coordination, and education. In addition, Mr. Speaker, the mutual reinsurance fund may provide funding for programs that support health for those vulnerable individuals that are uninsured or underinsured. The premium for the mandated package comprising of SHB and MRF is referred to as the standard premium rate, or SPR. Mr. Speaker, the SPR is generally calculated on the basis of the standard health benefit claims experience, the head count of insured individuals, projected changes in fees and utilization, and any benefit changes. Mr. Speaker, I will pause here to further explain the role of the SPR. Honorable members will recall the change to the SPR in 2019, which called for $322 million to be transferred to the BHB in the form of a grant from the government and a transfer from the MRF. The SPR also supports the Health Council, Chronic Disease Innovation Fund, full treatment for patients with kidney disease, the Enhanced Care Program, and Personal Home Care Program. Additionally, it funds the administrative functions provided by the Health Insurance Department and provides subsidies to HIP and Future Care. In this last year, Mr. Speaker, the BHB has been particularly challenged in meeting its commitments due to shortfalls with respect to the funding commitment it in turn requires to carry out its mandate. It has had significant additional expenses due to the pandemic, such as PPE and infection control costs. And at the same time, it lost a substantial revenue stream due to the drop in visitors to the island, which previously generated as much as $8 million annually. Mr. Speaker, the COVID-19 pandemic has upended many of the factors which previously informed the SPR. For a start, the number of insured adults in Bermuda has decreased. Mr. Speaker, for an employment-based health insurance scheme, this is critical. Revenue targets for the SPR over the past 2 years were based on a reported 49,027 insured adults. That head count is now reduced to 46,300 for calculation purposes as of December 2020, but is reported to be a low 46,181 as recently as May 2021. The loss of insured adults due to unemployment or emigration is real. It impacts the revenue which supports the organization programs and insurance funds that I just mentioned. In addition, Mr. Speaker, with respect to utilization, both HIP and Future Care have experienced increases in signups. The COVID-19 pandemic has altered the economy, with businesses contracting and downsizing. In the Ministry of Health, we have seen businesses and individuals terminate their more expensive private health insurance policies and transfer their health care coverage to HIP. And as we all know, Bermuda has an aging population, which naturally causes the burden on Future Care to increase almost automatically. Mr. Speaker, each insured HIP and Future Care client premium is subsidized by the MRF. The HIP subsidy currently represents 28% of the premium, and for Future Care, that subsidy is 47%. As more businesses and residents join the plans, the increased in associated costs and volumes factor into the annual assessment of the SPR, HIP, and Future Care. In fact, HIP and Future Care premiums have not increased since September 2015. Mr. Speaker, a most important element of the regular assessment of the SPR and the HIP and Future Care plans is a review of the benefits themselves in the context of our population's health needs. Mr. Speaker, as I've indicated to this House before, pharmaceutical intervention saves money and interrupts the cost and burden of disease progression. For seniors on Future Care, the coverage for prescription drugs comes with a cap of $2,000 a year. However, those residents on HIP must pay for all medications out of pocket. Enhanced prescription drug benefits for HIP and Future Care clients are being proposed with this legislation. Also, in assessing the benefits currently available, Mr. Speaker, we have identified maternity care and maternal health education as a gap in services for uninsured women. To ensure all children have an equal and healthy start to life, all uninsured women must have access to health care and education at this critical point in their life and the life of their unborn and newborn children. Mr. Speaker, Bermuda's current market realities, including our headcount of insured individuals and changes in utilization and benefits, caused the ministry to propose amendments to the premiums of the SPR, HIP, and Future Care. These amendments are based on a re-estimated downward of the insured headcount, take into account the COVID economic effect, a review of existing benefit coverage, and population health demands. Mr. Speaker, most importantly, the proposed benefits are supportive of enhanced public health and improved equitable access to critical services. Mr. Speaker, the main changes proposed in the bill tabled today, I will outline now. There will be a $45 increase in the standard premium rate, representing a 13.6% increase. This will account for a new reduced insured headcount to ensure that BHB revenue target is met, and it will support continued treatment for kidney disease patients. The trend is an increase in dialysis patients of 10 to 15% per year, and it will provide a new maternity care benefit for uninsured women, which will secure more equitable access regardless of income, insurance, or social status. There will be a $30 increase to the HIP premium, representing a 6.9% increase. This will be accompanied by the introduction of a new prescription drug benefit covering 100% of cost up to $1,000 in a policy year. There will be a $30 increase in the Future Care premiums, representing a 6% increase. This will be accompanied by an increase in the existing prescription drug benefit of $1,000, taking it from $2,000 to $3,000 per year. Mr. Speaker, this government remains committed to providing a system of health care that results in a healthier and more productive community. It must be stated, though, that we are in a period of transition brought on by an unanticipated and unexpected cost of this pandemic. Mr. Speaker, globally, the pandemic has shown a bright light on healthcare and all in its many strengths, but it has also highlighted the weaknesses. It has highlighted that access to affordable, high-quality healthcare is a basic human right, and one that this government is committed to seeing introduced for everyone. Mr. Speaker, our work on universal health coverage will set a new path for strengthening our health system. This work is ongoing, and we anticipate that before the end of the year, We will be setting out the steps we have agreed with stakeholders from across the system to start this journey afresh. The pandemic has provided us with a new opportunity to work shoulder to shoulder. We must now continue this positive collaboration and develop a health system that we can all be proud of. Thank you, Mr. Speaker.
Thank you, Minister. The next statement this morning is in the name of the Minister of Labor. Minister, would you like to put your statement?
Good morning, Mr. Speaker. Mr. Speaker, I rise before this honorable House to inform you that today the government will table the Bermuda Immigration and Protection Amendment Act 2021, which makes legislative amendments to advance comprehensive immigration reform by providing a process for long-term residents to apply for permanent residency in Bermuda. Mr. Speaker, in the Progressive Labour Party's 2020 platform, the government committed to work with the bipartisan committee to complete comprehensive immigration reform dealing with the issue of long-term residents. Mr. Speaker, this government seeks to make amendments to the Bermuda Immigration and Protection Act 1956 to secure permanency for long-term residents in Bermuda. These amendments are in alignment with the immigration reform strategy priority to achieve a simplified, fair, and modern immigration legislative framework. As promised in the November 2020 speech from the throne that was announced to the Bermuda public, this government is committed to making revisions to the Bermuda Immigration and Protection Act 1956 that will advance comprehensive immigration reform by providing a framework for persons to obtain permanent residency in Bermuda. Mr. Speaker, in 2016, the former government attempted to introduce a pathway for certain persons to obtain a permanent resident certificate and Bermuda status. This effort by the previous administration led to social unrest and was ultimately unsuccessful. It is within this context that this government is acutely aware that matters of immigration must be handled carefully and with a nuanced approach that strikes a balance between the needs and aspirations of various groups within our community. That is why this PLP government has committed ourselves to a bipartisan and consultative process to only advance changes that enjoy broad support and not ones that will cause rifts within our community due to lack of consultation and consensus. This government supports the view that persons who have contributed to our community for an extended period of time should have the opportunity to apply for permanent residency. To be clear, the government's proposals is distinctly different from the former government's pathways to status plan, as there is no proposed or automatic pathway to obtain Bermuda status in the bill I tabled today. Mr. Speaker, this government is well aware of the circumstances that allowed people to stay here for 20 plus years and instances where Bermudians were denied a genuine opportunity to compete for the jobs of those individuals. The past injustices are acknowledged, and the government will be revising the work permit policy to ensure they are not repeated in the future. As part of the strategic priorities previously outlined in this honorable House, the government is committed to strengthening enforcement of immigration laws and policies to ensure that Bermuda's immigration laws are adhered to and persons who break laws are held accountable. This government will always put its people first, and we have demonstrated by our actions that we are fully committed to protecting jobs for Bermudians. This is why the government has placed a moratorium on new work permits of certain job categories to ensure that Bermudians have an opportunity to train and work in those positions. Mr. Speaker, there is a significant interest within the community regarding this legislation, and today I hope to assure the public that the government understands the human aspects of this important subject. We understand that this is not simply about the passage of a piece of legislation amending an act from 1956, but it relates to keeping families together who may be separated and creating a fair avenue for permanent residency in Bermuda. Mr. Speaker, a real-life example of an individual whom this legislation will impact is a resident who moved to Bermuda in the late 1980s from the Caribbean at the age of 13 and lived with non-Bermudian parents that were on work permits. The resident attended high school in Bermuda and went on to join the Bermuda Police Service when eligible. They served in various mentoring and community capacities throughout Bermuda over the last 30 years. The resident was married to a Bermudian and subsequently was divorced and is a parent of a teenage Bermudian child. The resident holds a certificate of spousal rights. However, under current immigration laws, will have to leave Bermuda once the child turns 18 in a few short years. Mr. Speaker, having only known Bermuda as their home over the past 34 years and having contributed to various businesses, community services, and education, this resident will have to relocate and take all of the human capital that otherwise would have been contributed to Bermuda and move it to a new jurisdiction. More importantly, this resident will be separated from their Bermudian child and will no longer maintain the physical relationship that has been nurtured thus far. This legislation provides hope for this family. Mr. Speaker, the persons impacted by this change are of all colors, backgrounds, and socioeconomic classes. This change will enable those individuals an opportunity to continually reside in Bermuda. Mr. Speaker, this government has taken the balanced approach needed to provide a simple and effective solution for long-term residents to obtain a permanent residence certificate in a fair and reasonable way. The change will expand the eligibility criteria for the granting of PRCs to include any person who has been ordinarily resident in Bermuda for 20 years or more, expand the eligibility criteria for the granting of PRCs to include a non-Bermudian parent of a child with Bermuda status who has been ordinarily resident in Bermuda for 15 years or more, and expand upon the current provisions that allow the granting of PRCs to children born to second-generation PRC holders who have been ordinarily resident in Bermuda. Mr. Speaker, the government's changes will provide a more fair and consistent process of applying for a permanent residence certificate. Additionally, the policy proposals eliminate gender, racial, and financial bias by giving equal opportunity for all long-term residents. The recommended time period required to grant permanent residence certificates to individuals who have been ordinarily resident in Bermuda is very conservative. Approximately 96% of the 200 plus countries in the world have significantly shorter residential requirements for permanent residency. Mr. Speaker, in closing, the government has recently released a position paper on long-term residence to formally share the government's position that I have described today. Although some may believe these proposals go too far, as I articulated in my opening statement, this government believes that the balanced approach to allow certain long-term residents to apply for a permanent residence certificate is simply the right thing to do. Thank you, Mr. Speaker.
Thank you, Minister. The next statement, Minister, is also yours. Would you like to present that one at this time?
Mr. Speaker, I rise today to announce to the Honorable House the tabling of the Financial Assistance Amendment Act 2021 and the eventual tabling of the Financial Assistance Amendment Regulations 2021 as part of the Financial Assistance Reform Strategy. The act will be debated in this Honorable House following the normal procedure, and once it has been brought into force, the regulations will be made, as the regulations are subject to the negative resolution procedure. The regulations will come into operation when the Minister may appoint by notice in the Gazette. Mr. Speaker, this government is committed to improving the financial assistance system that currently helps those in the community who require financial support to meet their basic needs. Mr. Speaker, this reform strategy aims to chart a new course for financial assistance, making it more lucid, effective, and efficient system that places emphasis on transforming those who have been unable to participate fully in the productive economy and realize their potential. There is a more vigorous motivation to move able-bodied and able-disabled recipients into employment opportunities as soon as possible to avoid long-term dependency of the system. Financial assistance reform strategy consists of 4 overarching aims and strives to increase sustainability of the financial assistance program, strengthening the education, training, and employment services for financial assistance recipients, encourage individuals and families to become financially independent, and improve the program to better support persons with disabilities. Mr. Speaker, to execute the financial assistance reform strategy, legislative amendments will take place in two phases. The first set of legislative amendments include the following: defining a disabled person. 2, require a disabled person to submit with their application for an award a medical opinion which confirms the nature and extent of the disability, the fact that the disability impacts the person's ability to find or retain suitable employment, and where possible, the likelihood of the person being able to work after a period of rehabilitation or treatment. Where the medical condition of a disabled person receiving a financial assistance award has changed or suspected to have changed since being granted the award, the director may request that the recipient provide another medical opinion. 4, ensure that able-bodied persons have personal employment plans designed to place them on a pathway to employment and to promote successful performance outcomes. This is a collaborative exercise involving the Department of Workforce Development and other industry partners. There will be no deductions from their financial assistance award during the tenure of their agreement, which is not to extend beyond 3 years. This will allow them to build their assets and prepare to be self-sufficient by the end of the agreement term. 5, expand the eligibility criteria for able-bodied persons to include the completion of a personal employment plan agreement within the first 6 months of submission. Mr. Speaker, the new system will focus less on policing and administering rules and more on helping individuals access the services and support they need. Personal employment plans will provide clients with a valuable employment planning tool, promote greater collaboration between clients and their caseworker. It will also require taking action to addressing policing outside of the financial assistance, policies outside of financial assistance that impede progress toward achieving stable outcomes. And more importantly, sustainable employment for financial assistance recipients. It is our expectation that this approach will not only meet the basic needs, but also allow them to achieve a greater sense of personal and financial success. Thank you, Mr. Speaker.
Thank you, Minister. Appreciate that. Members, that brings us to a close of the of the statement period for this morning. And we'll now move on to the other items on the orders for today. The next item on order for today are reports of committees, and there are none. Moving on from there, today is the second Friday of the month, and for the listening audience, on the second Friday of the month, we include Premier's question under question period. So today we'll start with the Premier's question at this point, and for the again, listening audience, the Premier's question, there's a 30-minute period where questions from members are put directly to Premier. And then when that's finished, we'll continue with the regular question period from today's statement. So we're now at 11:25. We'll start the clock for half an hour. Mr. Premier, the first question this morning to you is from the opposition leader. Opposition leader, would you like to put your question?
Thank you, Mr. Speaker. Mr. Speaker, my question to the Premier evolves around the efficacy of the safe key. A number of people have said they have a safe key, but have never been tested. And given the rise of some vaccinated people catching the virus, there's concern that the safe key issue needs to be addressed, given that the those who are vaccinated are not tested on a regular basis at all. Can this Premier speak to the concerns that these people have about the efficacy of the safe key and the fact that a number of safe key codes have never been tested? And may be silent carriers.
Mr. Premier?
Thank you, Mr. Speaker. Mr. Speaker, I appreciate the question from the Honorable Opposition Leader, and it's a question that has been posed a lot of times. And I think what's important, Mr. Speaker, is that we give context to the entire situation of which the country is facing. And I think that it's important to recognize that we have put a number of steps and measures in place, and it would be difficult when our testing capacity is stretched as it currently is to then seem to say that we need to test additional test capacity. The questions of which he has asked on behalf of others have also been asked and discussed internally. But what we have to do is we have to balance all resources at play to what is going to what will amount to the best, I would say, avenue for the government to move forward. At this time, there is no intention or desire to introduce tests for vaccinated persons in possession of a safe key. We outlined what this matter was, what the safe key program was for, and understood. It is also important to recognize that, Mr. Speaker, nothing save for a full body spacesuit can prevent anyone from contracting any virus. That is just the nature of where viruses exist. What a vaccination does do is it trains your immune system. So if you are exposed to a small amount of virus, you can fight that off so you do not get to the point of being contagious. There would be some vaccinated persons who would be contagious, but that would then get to the place where the public health measures are in place. If persons are doing what they're supposed to do as far as wearing masks, not going out when they're feeling unwell, persons are checking. Those are the precautions that can be taken. It has to be a balance, Mr. Speaker. We do not have unlimited resources. It would be great if in this country we did have unlimited resources, but unfortunately we do not. And we have to understand that our public health measures have to be guided in the way where we can make the best impact and handle things the best possible light in light of constrained resources that we have.
Thank you. Do you have supplementary, Opposition Leader?
Yes, can the Premier also speak to the use of safe keys for private family events, i.e. wakes, marriages, birthday parties, so that the community is clear as to numbers that they have have to limit themselves to, and rather safe keys would be required.
Premier?
Thank you, Mr. Speaker. Mr. Speaker, as I think was indicated by the Honorable Minister of Health when the announcements to public health regulations were made, I want to say on August 17th, was that going forward, that safe keys would be required for all large group exemptions. But I think that it's also important to note that with safe key can be used for private family functions, which are not large groups. The current large group limit is currently set at 50, as I indicated in my ministerial statement earlier. It's expected that the Minister of Health will announce revisions to that. But even if you had 10 persons who were gathering at your home and you wanted to make sure that you were being safe, you can ask for safe key. And every single person can verify and check the status of the safe key. It is at verify.gov.bm. Persons can go to gov.bm /safekey to find out more information on that. And I think that it's important to understand and recognize that this is a tool that can be used for everyone. One thing that I will say, Mr. Speaker, and it is very important because there's a number of persons who are confused when it comes in regards to safe key for contact tracing purposes. Just like WeHealth, safe key is completely anonymous. So there is no government server checking and recording where persons are and where people are checking in. That is not how it is developed. The app reads the QR code and says whether that QR code is valid or invalid. That is all it does. Persons are not required to log in, provide any information for the use of it. It is something that is there. It is something that is open. And there are persons who are building apps on this to assist businesses.
Second supplementary?
Supplementary, Mr. Speaker?
No, the only person asking the question is able to have the supplementary.
No, thank you.
So, Opposition Leader, do you have a second supplementary?
Not on that topic, no.
Would you like to go to your second question?
My second question is, with the current spike, can the Premier provide details on the resources that he's making available for the ICU and provide some comfort to this country that government is providing required resources so that our hospital is not overstretched because of the spike? And can he share with the community what resources made available to the hospital?
I thank the Honorable Officer Shalita for his question. There has been no change in so far as the resources which have been provided to the hospital, and all those matters would have been detailed from the ramp up that we did last year to prepare for the worst possible case scenario, Mr. Speaker. So we do have ICU capacity, which was expanded, flex ICU capacity that was expanded, additional oxygen that was procured, additional ventilators that were procured with the help of donations. So the hospital is well prepared. The challenge, of course, of which we'll have is human resources. And that is a challenge which we're seeing throughout the world. That's a challenge which we're seeing throughout all of our healthcare systems. And you would have heard in my ministerial statement earlier that I've asked persons that they must be patient because there is stress and there is strain, and persons need rest. And the challenge, of course, which you'll have with persons who, because vaccinations have not been required in Bermuda, there are certain persons who are in the hospital and they have to manage those resources accordingly. But what I'd like to say is that I think that the hospital is doing a fantastic job. That they've been very transparent, but I think that also this week they have clearly set out in a number of interviews their financial position and the fact that they are challenged caring for the coronavirus. And the one thing I can say is that vaccinations are far less expensive to healthcare systems than treating COVID patients. And if we're concerned about the impact of the overall spending on coronavirus, what it has, we can recognize and understand that the more COVID patients are in hospital, the more that will, cost the overall healthcare system, the hospital, and the challenges in which they'll have for all of us who have to pay health insurance for the hospital through the Health Insurance Act, which the Honorable Minister of Health just spoke to.
Thank you. Supplementary?
No, I
Officer
don't.
Leader?
No, I have no supplementary.
Okay, would you like to put your third question?
My third question is this. The Premier said in the previous statement that going forward, the community will have to live with this virus like we live with the flu and other viruses. And it would be a way of life. Does the Ministry of Health have, or are they crafting permanent guardrails that will help the community and support the community in adopting the protocols with the COVID, if we are going to state that it's going to be a way of life? So what type of support and what type of work has been done if we are going to take this permanent posture?
Thank you. Thank you, Mr. Speaker. Mr. Speaker, I thank the Officer Shalita for his question. I think that it's important for us to recognize the basis of all public health interventions were to prevent the healthcare system from becoming overwhelmed. And it is important to note that there are certain sections of our healthcare system which currently right now are overwhelmed. Those would certainly be insofar as a testing system with a rush of people getting tested. And the hospital, of course, is experiencing a surge. The hospital does have excess capacity in which to handle COVID patients that are having to go back to their COVID plans. But that is the basis of our public health measures inside of a pandemic. The fact is, Mr. Speaker, if more persons get vaccinated, and thankfully, the majority of persons who are seriously affected by the coronavirus are senior citizens, and over 80% of that population in this country has been vaccinated. I think the numbers might be closer to 85%. That is helps to relieve pressure on our healthcare system. But the most important thing that which we have to understand is, Mr. Speaker, is that yes, we are going to have to live with the coronavirus just as we live with other viruses. And there are many countries around the world who had zero tolerance approaches, who changed their zero tolerance approach because they recognized that it could not be sustainable in the face of increasing deadly variants. What is important is to answer a point inside of the question, of which the opposition leader asked. Yes, the Ministry of Health is putting out guardrails, but it is clear, Mr. Speaker, we all know what we have to do. It is about wearing masks, keeping social distance, a proper hand hygiene, and staying home if you are well. Those are the basics. And once those basics are followed, then the country is in a good stead, and that reduces transmission. It is the basics that work for all variants. It is the basics that work for all respiratory illnesses that can be transmitted through droplets or through the air. And so from that perspective, Mr. Speaker, the guardrails are there. We understand what must take place, but what's most vital is people take the actions and steps to protect themselves. When I gave a speech, a national address in April, I said that persons can do their part by getting vaccinated. And if you choose not to get vaccinated, you can do your part by making sure that you observe public health measures. We do have a spike, Mr. Speaker. Our healthcare systems are strained, Mr. Speaker. It is vital that each and every single one of us and all leaders reinforce the position to those persons with whom we serve to say that it's time to make sure that we adjust our behaviors to make sure that we bring an end to this surge. But the fact is, Mr. Speaker, the coronavirus will be with us, and it is vital that we understand how to live and to cope. It cannot be blanket restrictions every single time that, in my opinion, Mr. Speaker, punish the vast majority of persons who are doing the right thing. That is the reason why we've spoken to the matter for the need for enhanced enforcement. Those matters are continuing, and as I indicated in my statement earlier today, there's a meeting later today, which we expect will result in robust enforcement activity this weekend. And all businesses are on notice that we must adopt a zero tolerance approach because it is part of not following what has been laid out that has gotten us
Do
here.
you have a supplementary, Opposition Leader?
No, Mr. Speaker, I'm done. Thank you.
Okay, Opposition Leader, you've asked your 3 questions. The next member who's indicated to have a question for you, Premier, is MP Terrell. MP Terrell, would you like to put your question?
Good morning, Speaker and colleagues. Thank you for that. My video should be coming up shortly.
Okay.
Yes, Premier, change in direction. With our peak tourism season coming to a close, would you say that Bermuda has had a successful tourism season?
Speaker, my answer?
Yeah.
Sorry. Mr. Speaker, I thank the honourable member for his question. And I would say that certainly we have had a better tourism season than some would have expected last year. Certainly, given the current circumstances where our top feeder market, the United States, is struggling to get the coronavirus under control, and the fact that we certainly seen some of the challenges and some of the pushback on our protocols which we put in place for visitors, I would say that what we've done is remarkable. We've seen new hotels open. Some hotels have seen numbers that are nearing 2019 numbers. This, of course, will be impacted by the closure of Fairmont Southampton, but it's also a benefit for the, or not benefit, but it's showing that the existing hotels the other hotels were able to hold their own. In addition to that, the fact that the Ministry of Transport has been able to work to have cruise ships homeboarding here has certainly been a success, and also cruise visitors, fully vaccinated cruises resuming. And I think there's been some that have arrived on island this week. And certainly when it goes to going forward regarding airlift, there's positive news, Mr. Speaker. American Airlines have just announced they'll be restarting their daily service from Philadelphia on November 18th, which is something that I know that a lot of persons were looking for, and certainly continuing their daily service throughout the winter, and weekly Miami service will return on November 20th. We certainly have good news from Canada, and certainly with their high vaccination rates, that is something that will certainly be welcome. And we are continuing to make sure that we enhance our tourism service from the United Kingdom for fully vaccinated travelers. So, Mr. Speaker, I'd say that it has been a success, and I want to say hats off to all the tourism workers, but not just the tourism workers, all the workers inside of the Ministry of Health who support tourism, the persons who process the travel authorizations, do the tests, and make sure that we can keep persons employed in tourism, which is vital for this country's survival.
Thank you. Supplementary?
No follow-up, Mr. Speaker. Thank you.
Mr. Speaker?
Next question. Hello?
Yes, Mr. Speaker. I was just wondering if you have me in your queue.
No supplementaries. The only person that has supplementary is the person to get the question.
No, Mr. Speaker. I'm just making sure you have me in line to ask a question.
I have a list of all members that are provided by the whips from either party. If you're on the whips list, you're on my list. Okay, if you're not on the whips list, you're not on my list. All right. The next person who's down for asking questions, next member, is MP Dunkley. MP Dunkley, would you like to put your question to the Premier?
Thank you, Mr. Speaker, and good morning to colleagues. Honorable Premier, a question that has been asked to me numerous times over the past couple of days is, as we've seen the fourth spike take shortly after Cup match, and UFC's doing regular updates, press conferences, will you consider having more regular updates and press conferences and not just releasing figures at night when most people have turned down?
Premier?
No, Mr. Speaker, I thank the honourable member for his question. I think the Minister of Health provided a very comprehensive update last week, Wednesday, and I know the Ministry of Health is committed to continuing to keep the public informed through technical updates and other matters. So I think that is important, but I think what's also important is that the country, as we position ourselves to live with the coronavirus and move beyond the pandemic, that we have to focus on the other matters in government. And that's where I'm trying to turn and to focus my attention. We have an economic recovery plan that we have to implement. There are things that we must make sure that we execute for the well-being of this country. And I have every confidence in the Minister of Health, the teams at the technical teams at the Ministry of Health can relay the information and relay the policy which is necessary to keep the public informed.
Supplementary?
Second question, Mr. Speaker.
You only get one question.
Supplementary question.
You get one question. When a member asks a question, they have a single question and two supplementaries. So if you like to exercise the supplementary, if you have no more supplementaries, then we'll move on.
Supplementary, Mr. Speaker. I thank the Premier for taking this into consideration. In the Premier's statement, the Premier said something along the lines, as long as we're able to properly manage the care for those who need medical attention generally and those persons with COVID-19, we have no need to revert to lockdowns and curfew. Earlier in the statement, the Honorable Premier said that there were now more than 20 residents in hospital. That's up double since the earlier release this week. And information coming to me says that the hospital has been very busy. To the Honorable Premier, how close is the hospital to a position where we might have to consider lockdowns and curfews? In other words, how much capacity is left in the hospital in light of the drastic increase just over the last week?
Premier?
Thank you, Mr. Speaker. Mr. Speaker, the question of how close the hospital does have excess capacity, and the hospital does also have, Bermuda Hospitals Board does also have additional capacity at the custom-built landfill clinic in St. David's as well. So the Bermuda Hospitals Board, we ran through our pandemic preparedness. We have to recognize and understand that at the beginning of this pandemic, when it was not understand how widespread asymptomatic transmission of this virus was, we were planning for the hospitalization of 100 persons. So it's key to recognize and understand where we are. Where the hospital will indicate to us when they are stressed and strained. I think what's most important, MP Dunkley, to understand, and I think what's most important for the public to understand, that the hospitalizations which we're seeing now are not due to actions which took place today. They're due to actions which may have taken place 2 or 3 weeks ago. So a lockdown today is not going to stop the increase of hospitalizations, or curfew today is not going to stop the increase of hospitalization. It's not going to stop those various things of stress. What is going to stop that stress is for all of us to adopt the public health measures, make sure that we are doing what is necessary to stop the transmission of this virus and ensure that more persons get vaccinated. And as time goes, that stress and pressure be released. It's telling to see, Mr. Speaker, however, and this is very unfortunate, because we are suffering from a pandemic of the unvaccinated. That element is my understanding that there is only one person that is in the hospital who has been fully vaccinated. All the rest are vaccinated, and that is what we see across the world. This is preventable. These things do not need to happen, and I would strongly encourage individuals and persons to speak to their doctor and get protected. This is the Delta variant today. It may be something else in the future, and it is vital that we are doing that type of work. So I understand the perspective where the honorable members asked the question. These are the discussions that we're having internally, Mr. Speaker, but it's important that as we, as a country, must recognize and understand that the best way to make sure that we can continue to live with the coronavirus, which is a necessity, which is just a reality of life, is number one, speaking to our friends and families and our doctors to make sure that more persons protect themselves against hospitalization. And number two, observing the public health measures which are there to keep us safe. If we do those things, the country will be okay.
Second supplementary.
Yes, Mr. Speaker, Honorable Premier is preaching to the converted on that point, and I fully support that. But the situation is changing quickly. Can the Honorable Premier, second supplementary, inform the Honorable House, has the hospital recommended curfews or lockdown at this point?
It is not for the hospital to recommend public health policy. That comes to the Ministry of Health.
Okay, thank you. The next member who has indicated a question for the Premier is MP Adams. MP Adams, would you like to put your question at this point?
Morning, Mr. Speaker.
Good morning.
Just adjusting my camera here. Mr. Speaker, just to piggyback on the opposition leader's question, in recognition of the wider use of SafeKey and the continued rise of cases, would the Honorable Premier share with this Honorable House any additional steps that businesses can take to protect their establishments?
Mr. Speaker, may I answer?
Yes, go right ahead, Premier.
Thank you very much, Mr. Speaker. Mr. Speaker, I thank the honourable member for his question, and I think one of the most important things that must be recognized is that it's essential that businesses do whatever they can to protect their business, and I think the best thing to do is to ensure that they are using SafeKey properly. Unfortunately, what we've seen are businesses that are just looking at QR codes, checking an expiration date, and admitting persons, and that is not the way that SafeKey was designed. SafeKey, like we'll become more and more accustomed to with the expansion of cryptocurrency and other types of things, uses a QR code. And a QR code is a secure code that can be scanned by a mobile device. And it's vital that businesses ensure that they check that their patron SafeKeys are valid by scanning it using verify.gov.pn. By scanning them using verify.gov.pn, which can be accessed on any mobile phone or any tablet. And what's also vital is that they must check the patron's ID to ensure that the SafeKey is being used by the appropriate person. The last thing that a business wants is someone who might borrow a SafeKey from someone or ask their friends to send them a SafeKey, or one of their friends will be vaccinated, they may not be, and they haven't been tested, and to go into an establishment, especially in the time when we have community transmission. So it is vital that the SafeKey is scanned on verify.gov.pn and it is confirmed valid and the ID is checked. And the other thing that businesses can do is just make sure that you are going back to basics. Ensure that staff are wearing masks. Ensure that patrons are wearing masks when they are required to do so. Make sure that you have hand sanitizer in place at the door. And ensure that if people are unwell, that you are not admitting them to your establishment. There's small, there is the view that business may say, oh, well, that's money I'm turning away. The last thing we want is for your entire business to be closed for 14 days. And that is what we're seeing happening across the country. So this goes back to personal responsibility and business responsibility. Businesses may want to go further than what the government has stated and mandated. Other businesses may want to implement those certain things. The government has given persons a tool in order to keep themselves safe and to understand how they can have safe interactions. And I encourage the country and businesses to go ahead and do whatever they feel is necessary to keep their businesses safe.
Thank you. Would you like a supplementary?
Supplementary, thank you.
Okay, thank you. Premier, the next member who has a question for you is MP Jackson. MP Jackson, would you like to put your question?
Yes, good morning, Mr. Speaker, and good morning, Premier. My question is around technology. I'm just wondering if the Premier would provide his position on advancements and improvements that can be made to improve the service of the hotline, the travel authorization app, the long lines at the Parrot Traveler COVID testing site, etc. And I must thank all of the human capital that is providing support. My curiosity is what is being done to advance and improve the technology or the processes to make these more consumer friendly and efficient.
Thank you. Premier?
I thank the honourable member for her question, Mr. Speaker. And I just want to touch on the various items of which she had said, because I think she said travel authorization, testing, and there may be one other point which I may not have written down. Insofar as what's taking place on the travel authorization side, Mr. Speaker, there certainly have been increases and improvements to the technology there. One of the most important improvements is what was causing a challenge for the line is when incomplete applications were submitted, persons needed to call to correct and to update that. But over a month ago, I do believe that an update was rolled out that if incomplete information was submitted, individuals did not have to call the hotline and they could go ahead and just click the link and update their information and go ahead and submit that information there. So I know that is one technology upgrade that has been made, and I know that the teams are consistently working on trying to make the process certainly more efficient. What I would say also is that I know that you would recognize we've rolled out 1-800 numbers to make sure that our visitors, our toll-free numbers that our visitors are able to access, or persons calling from overseas who are having difficulty there. I think there needs to certainly be more education. And being someone who traveled recently to the United States, I understand how difficult it is to get a test in the United States before you return back to the country. And that is something that causes a lot of stress. So we're going to make sure that we provide additional reminder of education on how persons can access these services online in the U.S. We're speaking about making more efficient in so far as testing here in Bermuda. Mr. Speaker, I'm just going to be a little bit more blunt than I normally are. In Bermuda, we are incredibly spoiled. And I say that because we have had an outstanding response to the coronavirus. In other countries, people have to drive miles to get tested. Many hours of waiting, extremely long lines. The system at Barrow, though sometimes lines get long, is an incredibly efficient testing system. They have things that are pre-printed. They have times where appointments are given. Persons can go through there. The lines are long, but the lines are efficient. And the challenge of which I have to say, Mr. Speaker, is that we are doing more. We have extended to visitors in large hotels where we're allowing persons to be tested in hotels. But some of those resources may have to be deployed for schools. And as we're seeing our tourism season, past the peak, there will be the redeployment of resources to focus on places where they are. But what I would say is I think that just like the honorable member paid homage to the teams that are doing the work, I think that they are doing an incredible amount of work. And though the lines sometimes can get long, I think that we should recognize that what we have here is still universally praised by visitors because they have been to other places in other jurisdictions and recognize that the waits that we have here are nothing compared to the waits that people have in other places accessing those services. So I think we should not just compare it to the view of which we have is that we want something right now. We shouldn't have to wait in line. We need to view it and compare it to the fact that what we are doing is an appropriate use of resources, and we're continuing the work to try to make it more and more efficient and make sure that we deploy the resources in the best way possible.
Thank you. Do you have supplementary question?
Yes, Mr. Speaker, I do.
Do you have supplementary?
Yes, I just wanted to focus in on the travel authorization form for a moment, as it causes so much angst for returning residents. And, I personally have seen people, tourists, visitors wanting to get to the island and unable to board a flight because the travel authorization isn't exact. My question to the Premier is that if and when a person or family has submitted the travel authorization information, if there's any way that that technology can, and has paid the $75 per person, if there's any way that that technology can verify that a person is allowed to then get on the plane.
Member, let me pause you for a minute. I'm trusting you'll be able to hear the alarm going off beside me, indicating that the 30 minutes for the Premier's question has come to a close. So I ask that we end the Premier's question period at this time, and now we'll start the 60 minutes for the regular question period related to either written questions or the statements this morning. And with that said, I believe we have one set of written questions this morning to be responded to orally. They are from MP Dunkley to Minister Meehan. MP Dunkley, would you like to put your question to the Minister?
Thank you, Mr. Speaker. To the Honorable Minister, Will the Honorable Minister please confirm for this Honorable House the total number of CCTV cameras funded by the government, which are monitored and maintained by the Bermuda Police Service, that are currently not working for any reason?
Sorry. Good morning, Mr. Speaker and listening audience, and good morning, member. Mr. Speaker, on this one, I just want to action guidance in particular on this question. There are some sensitivities around providing this answer and putting it in a public space. And I just want to know from your guidance perspective, is this something that I can agree with the member to provide to him in confidence?
Member, the minister is indicating that because of the sensitivity of the question, it's for security purposes, it's probably best that the answer is not provided in the public space, but she is prepared to provide it to you privately under the guise that you keep it as out of the public space. Is that acceptable with you?
Mr. Speaker, if that's what you wish, that's acceptable to me.
Okay, I will ensure that the minister gets the answer to you privately.
Yes, Mr. Speaker.
And I'd ask all members to respect the sensitivity of that answer. And I don't have a problem if you MPs shared it with your colleagues, but I'd ask that everybody respect the sensitivity and keep it under the public space.
Yes, Mr. Speaker, I appreciate it. I look forward from hearing from the minister. Just would make a brief comment is that often in the press, it is remarked that cameras were not working. And I just would like to make a note of that.
Thank you. What's your second question?
Second question, will the Honorable Minister please inform this Honorable House the total amount budgeted in the current financial year to support system maintenance and system upgrades to the CCTV system?
Surely. The BPS budget is $750,000 in total for CCTV monitoring, maintenance, and cameras.
Okay. Supplementary? You're muted.
You're muted.
Thank you, Mr. Speaker. Supplementary, yes. The minister did say for maintenance and cameras. How much is going to be spent on maintenance, and what is the amount for the spend on new cameras purchase?
We haven't purchased any new cameras at this stage. So far we have spent, I believe it was approximately $76,000 on some maintenance that we did.
Okay, thank you, Mr. Speaker.
Second thought?
No, Mr. Speaker. Third question.
Third question, go ahead.
Will the Honourable Minister please inform this Honourable House what the long-term plan and strategy is for the use of technology throughout the CCTV system by expansion or broader use?
The intention is, subject to our budget in the next financial year, to replace the existing system with a more modern CCTV system. A project team has been identified that are currently engaged in refining the needs for the next reiteration, including software investment opportunities for license plate recognition, speed detection, red light cameras, parking enforcement, both fixed and mobile, vehicle registration enforcement, arrest monitoring, shot spotter technology, and general analytical capabilities.
Thank you. Supplementary?
I thank Mr. Speaker for the Honourable Minister for that answer. That's what I was looking at with the expansion or broader use. The Minister did say that for the next financial year, I believe that this would be looked at. Is there a date when the government would like to see the implementation of this broader technology?
Member, our hope is to have the RFP out for early 2022 and to be able to implement the system as soon as possible from that date. The research has been going on now for some few months actually, and I'm pleased with what they've come back with so far. So it's definitely a project that we are progressing.
Thank you. Second thought?
No, Mr. Speaker, I appreciate the answer to these questions, and I look forward to talking to the minister about the first question asked.
Yes, thank you.
Thank you,
Members, that brings us to a close of the written questions for today. So we'll move on to the questions from the statements that were given this morning. The first statement this morning was by the Premier in reference to moving beyond the pandemic. And Premier, you have one member who's indicated they have a question for you. That's MP Dunkley. MP, would you like to put your question now?
Mr. Speaker, I asked that question generally during the Premier question period.
Oh, okay. All right, so we pass on that. The second statement this morning was that of the Deputy Premier. Deputy Premier, you have members who've indicated they have questions for you. And the opposition leader, would you like to put your question?
Any cure and collect invasive animals which are in our canals and mangroves. One knows that there are a number of turtles in our canals. What are we doing to manage those invasive species, other animals that have been released in the wild?
Minister? Minister? Is the Deputy Premier at his...
I'm sorry,
okay.
Mr. Speaker, I didn't realize you were calling me. Sorry.
Yes.
But was there a question for me? And like I totally missed it.
The opposition leader put a question to you in reference to your invasive species statement this morning.
Yes.
Opposition leader, would you like just to repeat the question?
Yes. Can the minister share with the public what programs he has in place to eliminate those invasive animals, i.e. turtles in the canals and mangroves, other animals that have been released into the wild? What type of program do we have in place to mitigate that risk to our ecosystem?
All right, thank you. The opposition leader's voice is very distant, but I did catch the question, Mr. Speaker, so I will answer. Those are programs that we will develop once even further clarity when the legislation is in place. But there are a number of invasive programs that we are already operating that are ongoing, and I'll just list those. Those are related to the lionfish, feral chickens, of course, feral pigeons, and feral crows. And we have ongoing management efforts in these areas, including with the terrapin turtle that he mentioned, to have much more attention in our nature reserves and to ensure that, unfortunately, those are species that we as humans are putting into that environment. So people need to be more responsible that when they buy their pets, Mr. Speaker, that when they get tired of those pets, they don't just discard their responsibility and put them into the environment, because that's why the species that the opposition leader mentions is there. It's not because of anything the government is not doing. It's because people buy them as pets and then throw them into the canals and other places. And so we're very vigilant on developing programs to be more effective with that. The upcoming legislation will help with that and ensure that we can not only protect the island generally, but specifically attention that we can ensure protections of our reserves and natural places.
Supplementary? Yes, put your supplementary.
Has the government considered being a depository for owners who wish to get rid of their pets, either leaving it on islands or people who want to have a turtle anymore? Have we considered putting together a depository for those animals so they wouldn't release them in the wild. And I mean, we can euthanize them after. But if we go on a public relations campaign and say, listen, if you want to get rid of your animals, the Ministry of the Environment will be a depository for them, and we'll either euthanize them or house them elsewhere.
I do believe I got the gist of the question, Mr. Speaker. As I said, the opposition leader's voice is very distant, but I think I got it. The answer is yes. If somebody wants to discard a animal that they have and they don't want to dispose it into the environment, they can bring it to the environment, the department, or of course they can take it to the aquarium. Many people do that already, and to make sure that any animal they find or they don't want to be left to the environment is properly cared for. So people can do that now, but we can perhaps structure a more clear message around that so that the public knows. Yes. Certainly, yes. They can. People bring items to the animals to the aquarium all the time that they find in the environment, so that they can care for them that are not even normal species of Bermuda. So we can certainly handle that, Mr. Speaker.
Thank you very much. No further questions.
Is there supplementary?
Yes, Mr. Speaker, I have a quick supplementary.
Yes, MP Jackson.
Yes, thank you. I'm just wondering if the minister has or is incorporating into the legislation anything around bringing back and increasing the population of certain species that have since been decreased, such as our land crabs, which were super popular with fishermen, etc.
Mr. Speaker, the answer is that there are a number of things that we are doing to replenish species that are challenged in Bermuda. I would prefer to deal with that in more detail when the legislation is debated. But the answer in a short is yes.
Thank you.
Thank you. Further supplementary?
Nothing.
None? Okay. Officers Leader, do you have another supplementary?
No, I'm fine, thank you.
Thank you. Minister, the next MP who's indicated they have questions for you on that statement is MP Pearman. MP Pearman, would you like to put your question?
Thank you, Mr. Speaker. Minister, in your statement to the House.
I can't see the honorable member, Mr. Speaker. I'm sorry. Oh, I'm sorry. He's in the same room with the other members. Sorry.
Yes, at the opposition office there.
Yes. Okay. Sorry.
Can you hear me, Minister?
Yes.
Excellent. In your statement on invasive alien species in the new bill that you propose to pass, you stated to the Honorable House that you want to emphasize that we are not intending to make criminals of persons who may have species that they're not even aware of growing in their gardens. Minister, are you aware that the bill that you've tabled today does contain criminal penalties at Clause 29, including 2 years in prison?
Of course I know. But again, the honorable member is asking a question that would be more suitable to be discussed during the debate. The answer is yes, I know that's there. But my statement is clear by my ministerial statement. No one will be criminalized for anything that they already have in their garden, which they have innocently planted, or perhaps has found itself there due to nature. Simple.
Well, supplementary, Mr. Speaker.
I understand you want to continue. Minister, there will be a full debate on this piece of legislation that has been tabled. So remember, when you ask a question, then sort of anticipate the debate, but I'll allow you to ask a question under guided conditions.
Thank you, Mr. Speaker. Obviously, I'm asking questions about a ministerial statement given this morning to the House, assuring the House and the public that he is not intending to make criminals of persons, and the bill actually would make criminals of persons. So, supplementary, Mr. Speaker, would be, will the minister consider civil penalties instead of criminal penalties for this bill?
I think, Mr. Speaker, that's a question that should come up during the debate. All due respect, I mean, that's,
Change it.
okay, he's asking about the legislation, not about my statement.
Minister, I'm asking if you're prepared to change it, and I'm giving you forewarning 2 weeks before the debate.
That is, anticipating the debate on the bill,
Member and Minister, no, I'll step in here. Member and Minister, I gave a guideline that we didn't want to anticipate the debate. The member has put out his concern. And Minister, I'll just ask you to anticipate that it will be part of the debate, and whatever response you have, you could prepare for the debate. So you've been fortunate to give a pre-warning of at least something that will come up in the debate.
Fine.
Okay, thank you.
I anticipate.
Thank you.
That's fine, I anticipate.
No problem. MP Perrin, do you have any further
supplementary, Mr. Speaker?
No further? Okay. And we'll move on. The next statement this morning that there are questions are for the Minister of Finance. Minister of Finance, the opposition leader would like to put a question regarding your statement this morning. Opposition leader?
Thank you, Mr. Speaker. First of all, in principle, I agree with what the Minister of Finance is proposing in principle. Anything to protect the consumer, I think it's worth examining and exploring. My question to him is from a corporate point of view. Most companies have code of conduct in place already. Is he proposing that we possibly would consider one of the agencies, the BMA or the Consumer Affairs Agency, to review and sign off on these code of conduct so that they meet the standards prescribed by the new legislation or by what government would be comfortable with?
Mr. Speaker, as I mentioned in my statement, the authority has done quite a bit of extensive work in looking at conduct frameworks that have been set out by a number of international standard-setting bodies. Page 3 and 4 of my statement, I refer to 5 bodies that the authority has sought to look at their work. While I appreciate that some companies may have standards of their own, I think it is appropriate for some sort of regulatory body to set a minimum standard to ensure that there is some degree of consistency by financial institutions as they go about conducting themselves in providing business and service products and services to customers in Bermuda. I would say that the notion of a conduct authority is not new to the world, and in fact, I can recall 3 or 4 years ago, in my position as an executive at one of the local banks, I forecasted that Bermuda would see the day when a conduct would be in place, because the trend at the time was that conduct authorities were being introduced in a number of places around the world. I'm of the view that that the regulation either goes around the world either clockwise or counterclockwise, but it always goes around the world. It was just a matter of time before it was seen here in Bermuda. I did not forecast that I would be the minister responsible for introducing such a regime, but we are where we are, and I think that this is a net good thing for both institutions and for their customers. I am of the view that a more informed customer is one that is better for companies, and so my hope is that this framework and this regime will result in the closing of the gap that currently exists between the knowledge of the institution and the knowledge of their consumers.
Thank you. Is there a supplementary?
I have a second question.
Second question? Put your second question.
As the Minister of Finance knows, most companies have a complaints management program. They also have a complaints register. And you will also note that most financial institutions are audited, and they audit the protocols for the management and administration of complaints. Can the minister confirm how this would fit in his program, or will it be separate and distinct from his recommended program? Or will there be any overlap in the program?
Mr. Speaker, as I mentioned in my previous answer, the objective here is to set a standard. And while I appreciate that a number of different organizations may have different levels of reporting and ways of dealing with complaints, the intention here is to set a minimum standard for which companies can certainly operate at levels above. My expectation is that some of the material that they currently produce for their own purposes, and also probably for the regulator, because there are today certain codes already inherent, resident in the legislation and in the BMA's regime, but this is intended to formalize codes of conduct across the financial services industry in Bermuda, and in as much as it is complementary or additive to existing things that are in place today at the individual company level, the better.
Thank you.
That's it. Thank you.
No further questions?
No further questions. Thank you.
Thank you. That's the last questions for you, Minister. The next statement this morning that has questions is the statement from Minister Furbert. Minister Furbert, you have two members who've indicated they have questions for you. The first is MP Pearman. MP Pearman, would you like to put your question?
Thank you, Mr. Speaker. Thank you, Minister. Minister, in your statement to the House today, you spoke about the stimulus project in fixing the stairs at Elbow Beach at the public access point to the tune of some $200,000. How does the ministry or the relevant decision maker decide what is a normal works and engineering project and what is something that gets outsourced to a third party as part of this stimulus program?
Minister?
Thank you, Mr. Chairman. Member. I believe that the smaller the projects are, that's where the stimulus comes in, because we can get it done very quickly. There are some major projects that has to be done, and those ones are more hideous and goes out for RFQs or RFPs. So they're very small. We're trying to get this thing and be quick and nimble and get things done very quickly.
Thank you. Supplementary?
Yes, supplementary, Mr. Speaker. Thank you. Minister, does that mean that works and engineering will now be freed up to do more public works projects if work they would otherwise do is being outsourced to third parties?
Well, not necessarily. So you have the works engineering still is doing some of the projects that they have to do, but those things that we need done much more quicker, and the work with what works and engineering staff is doing is still working, doing their day-to-day work. I use this example as far as the vegetation cutting. As you may be aware, that Parks has been working within the schools to get all that work being done over the last couple of weeks. But there are a lot of more work that still is going to be done, like in St. Davis and Georges and without Bermuda, that we are trying to hire small construction, medium sized, and even some larger ones to get some of that work done. So we want to get this done as quickly as possible, and hence why a stimulus to get the work done.
Thank you. Second supplementary, Mr. Speaker.
Yes, go ahead with your second.
Thank you. Minister, does this mean that the money for this stimulus program is coming out of the works and engineering budget, or is it coming from somewhere else? And
out of works engineering.
Is it anticipated that this will be a budgetary extension or not?
Nope.
Thank you, Mr. Speaker.
Any further questions? No further questions? Okay, the second member, Minister, has questions for you is the Opposition Whip. Opposition Whip, would you like to put your question?
Yes, thank you. Thank you, Mr. Speaker, and I thank the Honorable Minister. When will the Honorable Minister be able to inform this House the full number of jobs that have been provided to date I know that he provided some as it related to one specific project, but not all the numbers were provided, I thought.
I believe I believe I mentioned. Oh, let me see. Hold on, let me just check for you. Remember, if not, I can get back to you on that information. I thought we listed a total. And hold on. Yeah, the economic stimulus program has created at least 51 jobs, and 40 of them are going to Bermudians.
For the supplementary?
I would. Thank you, Mr. Speaker. As it relates to the total unemployment rate that we've seen recently sent, is there a success metric for determining that the economic stimulus program is contributing to the macroeconomy? Has that been determined by the government?
Statistics has not been run on that, but we will continue to strive to ensure that Bermudians get back to work. That $3 million, we want to increase that rapidly and get people back out to work. Hence why the team is meeting, matter of fact, this afternoon to make some things even happen faster.
That's all my questions, Mr. Speaker.
Thank you, Officer Whip. Minister, that's the conclusion of the questions for you.
Thank you, Mr.
The next statement this morning that has questions is the statement from the Minister of Health regarding the health insurance amendment. And the first MP who's indicated other questions is MP Pearman. MP Pearman, would you like to put your question at this time?
Thank you, Mr. Speaker. Thank you, Minister. Minister, on page 7 of your statement, you spoke to a $30 increase in the HIP premium and a $30 increase in the future care premium. For the benefit of the listening audience, is that a $30 increase per month on the HIP payment, or a $30 increase per year on the HIP payment, and likewise to the future care payment?
Mr. Speaker, that represents a $30 per month increase for HIP and the $30 per month increase for future care, which will equate to a further $1,000 of benefits for drug benefits for future care, which would take it from $2,000 to $3,000 per annum, and a $1,000 drug benefit for HIP patients, which takes it from 0 to 1,000. Currently, HIP does not have any drug benefits.
Supplementary?
No supplementary. Thank you, Mr. Speaker.
Second question?
Mr. Speaker, I have a supplementary.
Supplementary from MP Jackson. Put your supplementary.
Yes, thank you. Good morning, Minister. Just a quick question. Is there any possibility, given the fact that the premiums are increasing on a monthly basis, is there any capacity for no claims discounts or benefits for those, especially those on future care? If they are not claiming, that they may be able to some sort of reduced or discount or something? I mean, because the costs are getting so high. You're on mute.
Minister, I think your mic is muted.
Sorry.
We see your mouth moving. We didn't hear you.
Yeah, I'm sorry. I thank the honorable member for that question. The honorable member would probably recall that when it comes to the HIP the HIP policies and the future care policies, they are all pooled, which allows for us to have competitive advantage with respect to costing of services overseas, locally, as well as with respect to the drugs benefits. So they are all pooled, and that's why we're allowed to have a cost savings. In addition to that, as I previously mentioned, the HIP and future care are heavily subsidized by everyone else that pays into the insurance pool. So the reality is, because of the pooling of those particular clients and those particular policies, there would not be able to have that no cost benefits, so to speak, because they are heavily subsidized, and the pooling is what generates the benefits that they have and the cost savings that HIP and future care clients are awarded.
Supplementary?
No supplementary. Thank you.
Okay. Thank you. MP Pearman, would you like to put a second question now?
Yes, thank you. Now going back to page 5 of your statement, Minister, in the top paragraph, given the increase in the premiums for HIP and future care, will the subsidy percentages identified by you in your statement to the House change or not?
Minister?
I do not have that information offhand, but I believe that that's part of the calculation with respect to the MRF. So when those when the amount that's being proposed that's in the bill, it includes what the MRF transfer will be, which includes a further transfer to help continue the subsidy for HIP and future care. So that's part of the calculations as conducted by the actuaries.
Jim,
Right.
supplementary or new question?
Supplementary, Mr. Speaker.
It's a supplementary.
Hey, Minister, just so we're clear, because that was some complicated language. Even though the third-party recipients will be paying more in premium, the government is not proposing to either decrease or increase its subsidy levels. Is that correct?
That's correct. Part of the actuary exercise, which will be discussed obviously in a couple of weeks when we debate this, but part of the actuarial exercise included what would be the increase of premium to include the benefits that we've spoken about, as well as the transfer to the MRF, because the transfer to the MRF is what helps to keep the subsidy of future care and HIP as it is. So there's a higher transfer to the MRF from the to ensure that the subsidy portion that is paid for by the government for HIP and future care remains the same.
Thank you, Minister. Thank you, Mr. Speaker. No further questions.
Okay, thank you. And Minister, the next MP who has questions for you is MP Dunkley. MP Dunkley, would you like to put your question?
Thank you, Mr. Speaker, and good afternoon to the Honorable Minister. Honorable Minister, you mentioned the actuaries. Did the government follow the recommendations of the actuaries in regards to the increase in fees?
Mr. Speaker, there were a number of options that the government considered with respect to the increase of fees. Part of those options included what type of benefits. As you can appreciate, when you increase a benefit, then you have to increase the costs associated with those benefits. So all of those options were heavily discussed and considered by the government, and the option that was chosen was to increase the fees so that we could have prescription drug benefits for HIP and future care. Mr. Speaker, when we did the almost 7 or 8 months of consultation leading up to the health financing reform, one of the biggest refrains that we heard from members of the public was increase of future care drug benefits, as well as persons that were on HIP who had no drug benefits. So we are addressing that with respect to this particular increase. And the other benefit is, and I'm sure colleagues will share in the importance of this, relates to these 130 some odd persons that give birth every year that are uninsured. And this will allow for them to ensure that they have the best maternal health education, as well as the provision of the services that are required for giving birth, and that their children also get a good head start at life. Thank you, Mr. Speaker.
Supplementary?
Yes, supplementary, Mr. Speaker.
Yeah.
The Honorable mentioned on page 4 of the statement that the head count has been reduced over the past 2 years from people paying in from $49,000 to just over $46,000. Does the Honorable Minister think that this trend will continue?
Minister?
I thank the honorable member for that question, and I have to answer it by saying that's a very good question. I would not have any knowledge as to whether or not that trend would continue. I can't offer any comment on that, I'm afraid.
Okay, supplementary?
Yes, supplementary.
Yeah.
Well, if we assume that it will continue, what will be done to address the situation?
Mr. Speaker, that is somewhat of an arbitrary question. I can't necessarily answer a question that I don't know whether or not that would actually materialize. Obviously, if our head count continues to be reduced, then those are circumstances that would, as I've said before, would affect the transfers into the MRF, and we'd have to address that accordingly. But I don't have a crystal ball, and I can't anticipate what will happen tomorrow insofar as the head counts of our populations, as stated at page 4 of the statement, I'm afraid.
Okay. Second, another question. That was the 2 supplementaries. This would be your second question.
Another question, Mr. Speaker. That is a matter that needs to be addressed because it is alarming. So the second question, Mr. Speaker, is With another double-digit increase in health insured premiums and a smaller increase of 6% to those on HIP and future care, those who can least afford to pay it, what is the government actually doing to reduce this spiraling drastic increase of healthcare costs?
Mr. Speaker, I thank the honorable member for that question. As I stated in the statement, we remain committed to ensuring that we provide a system of healthcare that results in a healthier and more productive community, as well as that is accessible to all. Unfortunately, we've seen our numbers increase with respect to persons that are either uninsured or underinsured, and part of the Bermuda Health Plan that the government is committed to under the Universal Health Care System will address that. And as I said in the statement, we have been re-engaged. Unfortunately, we've had a delay called COVID, and we are now still continuing and those meetings with our stakeholders and members of the community to assist, and are confident by the end of this year we will be able to provide further information to honorable members and members of the public as to the progress we're making. But the government is still committed to universal health care through the adoption of the Bermuda Health Plan.
Supplementary?
Supplementary, yes, Mr. Speaker. Mr. Speaker,
Supplementary?
I was looking for some concrete steps to take place, but the minister did mention the introduction of universal health care. How will the introduction of universal health care decrease the burdensome cost of health insurance that everyone is paying in Bermuda?
Mr. Speaker, as we've spoken,
Minister, yes?
I'm sorry, Mr. Speaker, as we've spoken about in this House before, the introduction of universal health coverage will assist drastically with respect to our health care costs. We have a very, very high health spend, almost, I think we may be number 11. No, it's more than that. Each person, we have one of the highest health spends per capita of the industrialized countries. And unfortunately, that is not sustainable. Part of our way of addressing that, Mr. Speaker, was to look at the way that we finance our health coverage, which is why you will recall 2 years ago, we introduced this single payer system so that we can help to pool our resources and allow for a more equitable distribution as to what what are we paying for with respect to our health care. And it also will allow for us to provide more coverage for primary care. It doesn't make sense for us to not address primary care when we see persons that are regrettably suffering from chronic diseases. We know that our health outcomes are very poor, unfortunately, in this country. So we need to make sure that we have sufficient resources available to address providing for more preventative and primary care. The Bermuda Health Plan seeks to address that, seeks to look at prevention, seeks to look at an integrated model, which will also provide cost savings, and cost savings then are passed on to the consumer, as well as to allow for better health outcomes, which is our ultimate objective, Mr. Speaker.
Any parting words for Jordan? And he's supposed to eat up.
Thank you. Is there a supplementary?
Yes, Mr. Speaker. I assume that mic is not closed.
Sure. Just supplementary.
Thank you, Mr. Speaker.
Members, just let me just, I know you're all looking at the clock. We're going past the 12:30. After this questions to this statement, we will break for lunch and come back and do the questions to the remaining two statements.
Thank you, Mr. Speaker. A supplementary then, and I'll be finished on this then. Mr. Speaker, does the Honourable Minister expect then that with the answer on what government's plan is to reduce healthcare costs, which I'm not certainly accepting at this point in time, but does government believe that they can have some success next year and we won't see these alarming double-digit increase in healthcare costs this time next year when we have to address this situation again?
Mr. Speaker, as I've indicated in the statement, the HIP and future care fees have not been increased since 2015. We know that, unfortunately, we have an aging population. We have a demographic that is regrettably suffers from a high percentage of chronic illnesses. All of those factors do cause for an increase in utilization. So those are real realities. And we're certain that once we're taking steps to roll out our universal health coverage, we will be able to arrest some of the chronic conditions that we're seeing that are costing us more money. Unfortunately, again, Mr. Speaker, technology, advances in medical technology also come with a cost. So the reality is, we are unhealthy, and we know that there are commitments that the government has made with respect to universal health coverage. We are devoted and committed to that. Again, I do anticipate that we will see and hear more about this by the end of the year, and certainly we'll be able to advance the universal health coverage as is a throne speech objective by the government, Mr. Speaker.
Thank you, Minister. No further supplementaries?
I would like to, but I think I've used them, Mr. Speaker.
Yes, that's what I'm saying. There are no further. I'm acknowledging. With that, members, I'm stopping the clock right now. There's 18 minutes, a little over 18 minutes left for the question period. But we'll resume that for the last two statements when we come back, because there are members who've indicated they have questions for the remaining two statements. So, Premier, if you acknowledge the lunch period now, we'll break for lunch.
Thank you very much, Mr. Speaker. Mr. Speaker, I move this honorable House to now adjourn for lunch to return at 2 p.m.
Thank you. Any objections? No objections? Members, we stand for lunch we adjourn for lunch at this moment. Thank you.